Since the first COVID-19 case was reported in the island on March 10, testing has been mostly handled by the National Influenza Center, located at the Department of Microbiology at the University Hospital of the West Indies, as well as the Public Health Lab. Well, not anymore. The Health and Wellness Ministry has approved 2 private labs to administer the PCR COVID-19 test.
And that is the approval, finally, and I say finally, and I exhale when I say finally, of 2 private labs that are now able, with the sanctioning, the approval, and indeed the recommendation of the Ministry of Health, to offer COVID-19 related tests. This has been long in the making, a lot of dialogue, but I'm happy to say that we are now at a point where the validation studies have been done, the standards have been established and verified, and the first one, Carigen and Microlabs, Carigen working with Microlabs having the distribution network across the country, Carigen being an entity based at the University Hospital of the West Indies. Combined private sector entities are now able, for a cost or for a fee, to offer the PCR test for COVID with the sanctioning of the Ministry of Health and Wellness. And that was achieved this week based on a long period of discussions, testing and retesting, validation, and all of the other necessary steps to ensure that the public is protected and they get what they pay for. You can go to a Microlabs, and they're all over the country. You can get swabbed, samples collected, sent into Carigen, and Carigen will do the test, turn it around, and send back the results. The requirement is that this setup in the private space will require a reporting mechanism, because from a public health standpoint, we need to know how many people are positive in the country, how many tests are done, how many are negative. That's critical for public health planning and for decision making at the highest possible level, including the level of cabinet and the government. But it is a major addition to the testing arrangements in the country. No longer are persons required to only depend for the credibility of the process on the government entities, which would have been the Public Health Lab and UWI, but they can now, through Microlabs or directly to Carigen, do their testing for a fee.